it actually raises cortisol and shrinks the memory area. So you want a proper exercise program for you.
我们现在说到的就是有一些非常剧烈的运动，比方说长期的马拉松训练，这种剧烈运动对女性来说会增加您的压力荷尔蒙，导致您的脑容量变小，所以在选择运动的时候，应该更结合自己的身体状况，选择适合自己的。
Anything that can help you reduce or handle your stress is good for your brain. So whether it be a massage, or you learn to meditate, or you just take a nice walk, anything you can do to reduce stress, reduce cortisol, will improve your brain function and improve your hormones.
我们现在说到的就是压力管理在您的内分泌中也起到很大的作用，像比方说您出去散个步啊，或者做一个按摩，都会降低您的压力荷尔蒙。这里面还说到一个，就是您看图，就是静坐冥想也会帮助您减轻压力，它还会帮助您的记忆力、免疫系统、血压、抑郁等等。
Okay, what can we do for your bones? This is probably the biggest problem facing women in China today. The bone density of Asian women over 50 and after menopause is higher than any group in the world. So 20% of women will have osteoporosis. And maybe part of that reason is a number of Asian women don't drink milk or don't digest milk well. So it may be early on you never achieve a very high bone density. So this is a big problem in Asia, and this is something we want to help design a program to prevent this.
对于我们亚洲女性来说，一个最大的问题是我们我们消化牛奶的功能不像西方人那么强，这就导致对亚洲女性，我们超过50岁的亚洲女性是这个世界上骨质疏松指数最高的。现在有20%的亚洲女性超过50岁的亚洲女性有骨质疏松，而对于白人女性中只有10%。
So how would you assess your bone health? There's a number of ways you can do it. One of the common ways is called a DEXA scan. It does have a radiation exposure. You can begin to do those kinds of exams somewhere between the ages of 40 and 50, maybe earlier in some cases. A new test called an ultrasound, which has really become more sophisticated, does not expose you to radiation and can pick up early osteoporosis. And then what we do is we do some kind of imaging, and then we follow it up with a urine test.
如果您想了解您的骨骼状况的话，我们最常见的检测是一个 X 光检测，但是这个检测呢，它有一定的辐射，所以不建议经常做。它适合如果您的年龄到了40岁，您需要做一次。我们在锐健提供了一种根骨的超声波检测，这种检测是没有辐射的，它可以在您很早的时候就能检查出您有没有骨质疏松的风险。同时，我们还有一种尿液检查，它是来找到一个我们的骨吸收指数。如果我们骨吸收指数更高的话，骨质疏松的风险就更大。所以这两个检测结合起来，就是一个很好的骨骼检测。
So the imaging, whether it be ultrasound or DEXA scan, tells you where you begin, and then a urine test tells me how much bone you're breaking down. We design a program for you, including whatever exercise and hormones and some nutritional things. And then in a few months, we can go back and look at the urine and see that our program is working. So you don't have to wait for a year or 2 years to get another imaging test on your bones. We can tell that we've stopped the bone loss by following this urine test.
我刚刚提到的根骨密度的超声波检测和尿液的骨吸收检测，这两个检测可以帮助您判断您现在的骨骼的健康程度。同时，在您接受了 骨骼健康治疗之后，这2个检测也是比较容易做复查的。您可以几个月之后再做一次这样的检测，就可以知道您的治疗有没有效果。
And this is just talking about the ultrasound diagnosis of osteoporosis. It's going to be, it's going to really help because it'll be available to a lot more women, and there's no X-ray, and I think they're going to be having it at this medical spa.
现在说的就是这种超声波的根骨密度检测，它很方便，然后做这个检测的时间不需要很长，同时因为它没有射线，所以它不会对您造成任何的伤害。
And I think in China, women probably should get this test earlier than later because really, even in the young, you're probably at risk. And the sooner we find out about it, the better we can do for your bones, the stronger we can make your bones.
在中国，因为我们作为亚洲人，所以我们的骨质疏松的风险可能比其他的国家的人更大。所以对中国的女性来说，应该更早的来检测我们的骨骼健康，然后尽早的进行预防或者治疗。
And the risk factors for osteoporosis, a number of these you can't do anything about. Just being Asian, being female, being older than 50. These are things that are just so common. Can't do anything about that. Low body weight. So there's a number of things that are so common to all of you that put you at risk. So this is probably one of your greatest risks as you get older.
这现在说的是一些因素会影响我们的骨质疏松的风险。比方说，第一个也是我们不能避免的，就是亚洲人的骨质疏松比其他的种族更多。然后女性的骨质疏松指数也会比比男性更多。50岁以上，还有假如您的体重很轻。您曾经有过手术，子宫的手术，或者平时运动少、缺钙，都会导致骨质疏松的风险增加。
Again, sometimes there's no symptoms at all, and the first time you know about it is when you break a hip or you break a wrist. And hip fractures are very serious, and then it can be associated with prolonged disability and even death.
另外一个很重要的就是，因为骨质疏松它之前是没有任何症状的，所以您如果不进行检测，可能不知道您会有这样的情况。而骨质疏松如果一旦发生的话，它的后果也是很大。
So many nutrients are needed for bone. Again, I always stress to my patients, we can tell exactly what you need by doing some of these other studies that will be offered at the spa. So we're not guessing. So not everybody needs everything, but vitamin D, calcium, K2 is very interesting. You can get it if you eat natto, but these are some things that are needed.
一些营养元素会帮助您的骨骼健康，比方说钙质、维他命 D 还有维他命 K2。在我们锐健，我们提供了身体营养元素的检测，所以您会知道您缺什么就补什么，不会盲目的补。
And there's a number of foods that are good for you, but almonds and bok choy and broccoli are very high in calcium. Soy milk is very good as well. Soybean, tofu, all high in calcium.
还有一些食物也会补充钙质，比方说像坚果类、西兰花、黄豆等等。
And then there's a number of other nutrients, magnesium, lysine. Again, these are things that can be absolutely measured, so we can customize your program.
还有一些其他元素，还有一些氨基酸也会帮助您的骨骼健康。
So one of the tests that will be offered is through a company called Metametrics. It's a urine test, so they can do it here. And it looks at all your nutrient deficiencies. It can look at your amino acids. It can look at your minerals. It can look at your toxic elements. And then that information can be used to really come up with your program.
现在说的是我们在用的一家美国的化验室，它会帮您检测您身体中所缺的元素， 然后像矿物质、毒素，还有氨基酸、脂肪酸等，这些检测都可以帮助您更好的定制您的营养治疗。
So is aging inevitable?
衰老是不可避免的吗
？It is. We're all going to age. But can we impact how we're going to age?
是的，衰老是不可避免的，但是我们可以控制我们衰老的方式。
So there's a number of theories why we age. We'll just briefly touch on these, and then we'll probably get to the most interesting one, which I think are the hormones. But so a number of theories: free radical damage, nutrient deficiencies, and then we're going to talk at length about the hormones.
目前关于衰老的研究的方向有好几个，比方说自由基您的营养缺失，还有一种最新的您的端粒变短，还有科尔医生最擅长的就是内分泌治疗。
So a free radical is a little compound that's missing an electron in the outer shell. And because they like to travel in pairs, it's very unstable, and it steals it from your other cells and causes damage.
我们现在说的是自由基对，自由基会影响您的新陈代谢率，然后自由基。
So a wrinkle is free radical damage. So
比方说像我们皮肤上的皱纹也是由于自由基的损伤而造成的。
There are many age-related diseases that are mediated by free radical damage.
有一些下面我们要说的是一些症状或者疾病是由于自由基伤害而造成的，比方说老年痴呆症、帕金森症，像心脏病、关节炎、癌症、皱纹等都是。
An antioxidant gives up an electron and kills the free radical.
抗氧化的补充品会帮助您降低自由基损伤。
And there's many antioxidants. But the important thing is you can measure, so you can look at the amount of free radical damage going on. And this is important because sometimes you have adequate levels of antioxidants, but you're still causing damage to your cells. You're still damaging your DNA. And unless you know this, you don't have the information needed to change this around.
所以说最重要的就是我们要检测自己身体中这些抗氧化的元素的目前的水平，这样会更好的帮助您定制您的抗衰老计划。
So this test is available. The other theory on aging is it's called mitochondrial damage. So the mitochondria are how you make energy in your body.
线粒体损伤也是一个衰老的原因。线粒体在我们身体中，它担任的角色是让我们更有精力。
So you can look at how your mitochondria are functioning. So mitochondrial dysfunction associated with Alzheimer's, heart disease, lots of neurodegenerative diseases. You can actually tell what you're missing, how it's working, and mitochondrial dysfunction is aging.
我们通过血液检测可以知道您的线粒体的损伤，然后当您得到您的身体，就是从血液检测中得到您身体状况后，可以更好的帮助您做提早的预防。
Sometimes I'll have a patient that tells me, when I exercise, I feel worse. That's a patient most likely with mitochondrial dysfunction.
像一些病人，他们会说，他们在运动的时候会感觉到更疲倦，而不是更轻松。这种病人通常是有线粒体损伤的。
So aging is a natural process. We're all going to age, But the point is, right now, we're so fortunate because we have a lot of tools that assess how you're aging, and we have a lot of things that we can do to impact the way you're aging.
因为衰老是一个自然的现象，我们只能控制我们衰老的速度，所以对目前来说，我们应该及早的做健康的检查，然后知道您身体更需要什么，再为您定制一个最适合您的抗衰老的计划。
So we're going to take a little break and we'll answer questions, but the next part of this will be all about the hormones.
我们现在可以就是先休息一下，我们下一个讲座的内容是关于内分泌和抗衰老之间的关系。有没有人有问题可以过来问？说的那种，比如说越经历越觉得累的，就是一个限制的书嘛，还是
I think they have a huge potential. That's probably going to be our next part. I think there's two chapters. 我把我计划都讲了，不知道你够啊。Yeah, so exercise is great, and those hormones can start changing. So what we do is kind of see where you are, and then create a program and change. So you never have to really so I treated myself in that, and I never had problems. I never had all the craziness. So you can start very early. Yeah, Americans are probably more worried about Chinese people. I think yeah, they do vitamins, they do hormones. You know, there's so many so America,
我是比较没吃过，我说这现在的饼都是什么样的？
Well, they're going to have physicians who are working in Beijing as well, and they can work together on some of the evaluation. You might have to travel when you travel, so maybe So we do use it. No. Oh, no. I don't have the issue with that. So you want to put me in that? They can do the work all year. So, but, yeah, I think we get really good. But, you know, for men, men will hire men our age that, you know, I have in my practice a number of men younger and they're in a high profile, and they're really fit. We see low testosterone, and then we see actually low testosterone. But like at that age, you know, cardiovascular, so it depends on your family. And so we get very sophisticated So a great test for you is to look at your nutrient deficiency. Once you're done, that would be a great kind of bar because, you know, the last thing to do is and so when you are done to get an how long are you so we get involved after breastfeeding for the next one, and then we get back some people but it is really so something like that where it's it's a lot of fun. Yeah.